Hello, my name is Jeremy Carroll. I'm a registered nurse, and I will be performing a head-to-toe assessment with also a piece about the abdominal male and female genitourinary and breast exam. This is for Ohio Christian University, the Health Assessment and Genetics class NR 3400, and this is my patient with consent, Tiffany Carroll. I'd let you know ahead of time, since we're in an off setting, that I have washed my hands. And the first thing that I would be doing with a normal head-to-toe assessment would be collecting subjective data, history and physical, family history, and then definitely explaining that we will be doing a head-to-toe assessment today. We'll do some different areas where we'll touch and we'll listen, and we'll do some different activities. And you okay with that for today? Great. First, I want you to tell me that if you experience any pain or discomfort during any part of the examination, I want you to let me know, so that way we can alter or discontinue, and also it will help with our findings. The one thing that I may not always touch on for the video's sake, but is that we will be doing skin inspection throughout the entire examination. That consists of checking the color, the turgor, the temperature, moisture or dryness, and consistency and symmetry from one side of the body to the other. So the first thing that I want to do is assess speech and language and the rate, as well as orientation neurologically. Can you tell me your name, please?
Tiffany.
What's today's date? That's always a trick question, I know.
February 16, 2015.
Good. Do you know who the president is right now?
Obama.
And where are you at right now?
My house.
Excellent. Have you been having any issues with your sense of smell?
No.
Great. The first cranial nerve is the olfactory nerve, and that is the one that typically doesn't get assessed unless a patient has a complaint of an issue with their smelling or nasal drainage. So the next thing we're going to go into is we're going to inspect the head, looking it over, looking for hair color, looking for symmetry, looking for the texture and consistency of the hair, looking for masses, lesions. If you see something, this is definitely a time to don your personal protective equipment, gloves, and whatever else you might need to. But we're going to feel through the hair here. We're going to feel for any lesions or masses. Nothing there. Good. Good deal. And also, this patient does not have this problem, but if there was an issue with hygiene, this would be the first place where you would want to discuss that with the client. Next, we're going to inspect the face. We're looking for symmetry, color, consistency throughout. We're going to go ahead and palpate the sinuses. And so we'll start with the frontal sinus with a little pressure. Do you feel any pain when I push?
No.
What about the maxillary sinus? Any pain when I push?
No.
Occipital, you feel any pain when I push?
No.
Excellent. This is also a time around now, or really any time during this assessment, where we could be teaching what I like to call the ABCDE of skin, and it deals with moles and or discolored areas of the skin. The A stands for asymmetry. You're looking for that. B is for borders, if those change or if they're irregular. C is for color, and it's with changes with the consistency on at least a monthly basis for self-inspection. D is for diameter. You're looking for an increase in size, and E stands for elevation or enlargement, and that's definitely a sign that you need to probably have follow-up with a dermatologist. The next thing we'll be checking is the second cranial nerve, the optic nerve, with some confrontation things. So the first thing I want you to do, if you could for me, is to cover your right eye for me. And I want you to follow my finger here. We're going to go out and in, up and down. Good. Corner, corner. Good. Can you switch hands for me, please? Left hand to left eye. Again, out and in. Up and down, corner to corner. Good. That's actually the 6 cardinal views, which also is checking the oculomotor, which is the 3rd cranial nerve, the trochlear, which is the 4th, and the abducens, which is the 6th. We will also be checking peripheral vision, so I would like you to stare directly at me and turn your head a little bit for me so you're looking right at me. Now I want you to tell me when you see my arms when my fingers wiggle. Good?
Okay.
Good?
Okay.
Good. And the other thing that we want to do is to check her accommodation. And I have my little card over here. And I want you to stare at a spot over there. Okay? I'm going to put a card in front of your eye. I want you to keep trying to keep your focus. I'm going to move it in and out. So in, out, good, out. Good. There's no nystagmus or convergence with the eyes there. And then the last piece here, we're going to use a little object here, and I want you to steer directly at it. So I'm going to come right at you with it kind of quickly. Good. We're looking for that, the confrontational issue there. The other thing I would be doing with the eyes, we're looking at the sclera and making sure they're white, not jaundiced or yellowed in color. And the conjunctiva, can I take a quick peek? We're going to do a little pull down the eye there. Good. Pink and moist is what we're looking for, and those are good and healthy. The next cranial nerve that we'll be checking for is the trigeminal nerve. I'd like you to clench your teeth together. Let me feel you good. And then also, can you close your eyes for me? Good. And we're going to, I don't have my Q-tip, I forgot that one. Okay, tell me when you feel and where you feel.
Right cheek.
Good. Left jaw.
Left jaw. Left forehead. Right forehead. Left cheek. Right jaw.
Perfect. Excellent. With that, you would typically it would be like a Q-tip, or a tissue is an even more sensitive test for that piece there. The next one is for cranial nerve number 7, which is the facial nerve. Can you raise both eyebrows for me? Good. And can you puff your cheeks out like you're about to blow out a candle? Perfect. You're looking for symmetry there, and that shows good intact cranial nerve. The next thing that we're going to be doing is the fundoscopic exam, and basically you want to get your ophthalmoscope ready, get your light source prepared, and the first thing that I would like to do is use my non-controlling hand. So left hand is going to go to left eye, and my left eye also. So I'm going to mark the eyebrow with my thumb so that way I know where I'm at. I also like to use my pinky on the controlling hand to make sure that I don't bump into their face. And I'm going to turn my light source on. Perfect. We're going to come directly into the eye until we're 1 to 2 inches away, looking into the retina. Using my diopter to change, I'm looking at the retina, the vessels, the macula, and the optic disc. I would repeat that for both sides, but for the purpose of this video, we will not do that today. The next one that we will be checking is cranial nerve number 8, which is the vestibulocochlear exam. And what we'll be doing is a whisper test. So I'm going to say a number from behind on one side, and I want you to repeat out loud what I said.
29.
Perfect.
49.
Perfect. So that is intact. The next thing that we want to do is we're moving down the head. We're going to check the ears and the symmetry of those. Also, you can note things like piercings and other things like that. First, we're going to feel here. I'm going to feel around, make sure there's no masses, lesions, or bumps, and I'm going to give a little tug of the back. Does that hurt any at all? Good. That tug test is important prior to using the otoscope. You don't want to enter the ear if there's any pain with the tug test, because it could mean that there is an occlusion or some kind of infection that's going on. With our otoscope, we're going to be viewing the canal of the ear as we enter in. So when I start, again, I'm going to be using, for left ear, I'm using my left hand. I'm going to use a pencil grip, and I'm going to get a hold of the pinna of the ear with my right, pull up and back, starting in the canal. I'm going to look at the canal as I go through, moving in until I spot the tympanic membrane. Perfect. It's pearly white. Also, we're noticing the handle of the malleus, the light reflex, pars tensa and pars flaccida while we're in there. It all looks healthy. And again, you would repeat that on both sides. This is also a time when I don't have one, but if you had a tuning fork, you could check for symmetry of hearing by utilization of a tuning fork. The next thing that we're going to do is we're going to change our speculum on our ophthalmoscope, or otoscope, excuse me. And we're going to be checking the nares, or the nose. First, I would be inspecting for symmetry, looking for any deviation. Next, again, similar to the ophthalmoscope, hold hand to the forehead, thumb to the nose, and I'm going to start back first and gently move in towards the nares, looking at the mucosa. I know it tickles, sorry about that. Looking at the turbinates and checking for deviated septum or any abnormal drainage or polyps with that. The next thing that we need to do is to inspect the mouth. We'd be looking at the lips and around the mouth, looking for cracks or lesions. We're going to be checking inside the mouth as well, checking for the tongue, the palates, dentation, mucosa, checking for any masses, making sure everything is midline. And during that time, I'll also ask the patient to say ah, extended ah. I'll be checking the uvula for midline, and when they do pronounce the ah, the uvula should rise. Those are all checks for cranial nerve 9 and 10, which is the glossopharyngeal and the vagus nerve. So we'll go ahead and take a quick look around. Okay, can you open up for me first, and we'll take a look around. Good. Tongue out, please. Perfect. And can you say ah?
Ah.
Perfect. Good job. The next thing we want to do is check the neck, and we're checking for symmetry, range of motion. Can you give me a quick look to the right as far as you can, look to the left as far as you can, chin to chest, and all the way back without bending your back. Perfect. We're going to get a quick feel here around the neck. Everything's supple. Feeling lymph nodes while we're in here. And we're going to check the position I'm in for a frontal approach for checking the thyroid. Perfect. Now, I'm going to put my hand here. I want you to push against me. Good. Push against me. Good. Push against. Good. And pull against me. Perfect. Excellent. All of those also checking the spinal accessory cranial nerve, which is cranial nerve number 11. And also checking for the palpable lymph nodes, pre and post auricular, occipital, and of course checking the thyroid like we did there. Next, we're going to move to the lung and chest area. The first thing I would do again is an inspection, looking for symmetry, looking at skin, making sure that the AP angle is a 2-to-1 for Tiffany here, so she's perfect with that. The next thing that we're going to go and have her do is, I'm going to have you swing your legs over to this side for me, if you can. And we're going to check, you can swing them off the top. Perfect. We're going to be checking for fremitus. So I'm going to use the ulnar side of my hand, and I want you to say 99. Good. 99. 99. 99. Good. Excellent. The vibration would change if there was any issue with consolidation or anything along those lines. While I'm back here, I would also be checking the perispinal area for tenderness. Is there any soreness or tenderness down here? As well as checking for sacral edema. Next, we're going to do percussion, and I'm going to actually go around behind her for that. And I'm listening for resonance. Trying to follow every other rib with the vertebral angle here. Good. Good. The next thing we're going to do, I need to grab my ruler here, is check your diaphragmatic excursion. So what I'd like you to do is take a deep breath in and then blow it all the way out and hold it for me. Blow it all the way out. Good. Hold for me. Good. Right there. Okay. Deep breath in. Hold for me. Perfect. Right there. You can breathe normally. Good. You're right at 4 centimeters, and 3 to 5 centimeters is normal for the diaphragmatic excursion. Next, we'll be checking the costovertebral angle and checking for CVA tenderness. So I will be placing below the rib cage. I'm going to place my hand flat using the ulnar side again. I'm going to give a little tap. Tap. Any pain when I do that? Good. That would indicate some kind of kidney issue or other issues along there that are non-lung related. The next thing that we'll be doing is auscultation. So when I ask you, Tim, have you take some deep breaths for me, okay? Make sure we're using the diaphragm side. Go ahead, take a breath for me. Good. Good. Perfect. Sorry. Good. One deep one. Good. One more deep one. Perfect. Now I'd like you to say E for me. Hold it. Longer. There you go. E. Good. 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 One more on each side. Good. Great. That checks for consolidation. If the E were to sound like an A through the stethoscope, then it could mean that there was a mass or some kind of consolidation in that area. Go ahead and lay back for me if you would. The next thing that we'll be checking for is the front of the chest, the pericardium also, and the lungs at approximately a 45-degree angle. Tiffany's close to that. I'm going to take a quick peek at her to check her jugular veins for jugular venous distension. And right now, go ahead and relax your neck. Good. Supple, flat. Carotid arteries are intact. That's perfect. And this would also be the time when I would be looking for symmetry, rise and fall of the chest. I would also want to go ahead and give her a quick check to her brachial arteries. Perfect. And you can also palpate the precordium here, and then we'd be checking to make sure there's no masseter tenderness, and I'm feeling right now for the pericardial pulsation. Perfect. Excellent. We're going to do a quick percussion on this side as well. So you tell me. Okay. Good. As you get into the center of the chest, you want to make sure you avoid breast tissue. It just occludes the percussion. Good. Perfect. After percussing, we're going to take a quick listen here to auscultate the front. Of course, for the lungs, it's for air movement, so we'll start with that. And again, using the diaphragm, and we're going to avoid breast tissue. Go ahead and take a breath for me. Perfect. Good. Good. Sorry, I'm going to push there. Good. One more deep one. Good. And one more deep one. Good. That would be the component for the lung portion, or the pulmonary portion. Then we would be moving right into the cardiovascular portion. I'm going to be checking for regularity, clicks, rubs, gallops, any abnormality with the heart. And we want to make sure that we listen in all 5 areas of the cardiac region. I'll start with the diaphragm, listening for normal heart sounds, and then we will transition to the bell. Again, going through the same motion, listening for deeper sounds as far as those gallops, clicks, rubs, or any murmur type action. So we'll start off here with the diaphragm. Listening, I'm going to move your necklace here a little bit. Good. Just bring normal. Good. And while I'm here, I'm going to go ahead and check her radial pulses as well to make sure they match her heart rate. Good. We'll switch it over to the bell. It's a little bit deeper. I'm going to have to push a little bit more with it, okay? Good. Good. S1, S2. Good. We'll listen to this side here. And I'm going to have you take a quick roll towards me, to your left, just right there. That's perfect. Having the patient turn to their left side while listening to their apical helps right at the apex to hear any hidden murmurs. Excellent. Thank you very much for that. At this point, we would be going into the abdominal, GU, and breast examination portion, and for the purposes of this video with Ohio Christian University, I will just be talking you through that portion. Starting with the abdomen, we would normally expose the abdomen. We would inspect the skin for bulges, ecchymotic areas, any abnormality, any painful area, and of course you would want to make sure to palpate or do any percussion to that area last. Auscultation is for all 4 quadrants with the diaphragm, and it actually is a 9-position area across the abdomen, starting in the right upper quadrant and kind of working your way around through the quadrants there. The second part of the auscultation portion is with the bell of the stethoscope, and it's more around the aorta, checking for bruits, and then also you would be checking the renal arteries in this area, the iliac arteries, and the femoral arteries. After that point, we would palpate, starting again right upper quadrant, working our way around. Light palpation first, and then a deeper two-handed palpation is typically used. We would also, just left of center and above the umbilicus, we would be palpating for the aorta, looking for a not greater than 2 centimeter width for that portion there, as well as using the hooking technique for palpation of the liver, and trying to palpate the spleen. Some people we can't get to that, but especially if it's enlarged, and especially if you have them roll to their right side, you should not be able to palpate the spleen at all. And lifting from the back and palpating for the kidneys in the lower quadrants of the abdomen. While you're doing your palpation, you would also want to check left and right-sided rebound tenderness to make sure that there was no issue with appendicitis or anything like that, and moving down into the pelvic and suprapubic areas to check for lumps or any herniated areas as well. From there, you would go to percussion, same technique, non-dominant hand, middle finger, with the dominant hand, middle finger tapping, listening for tympany. Anytime you're over solid organs like over the liver, it should sound dull. Other areas where there's gas and fluid, there should be a tympanic sound. You would be percussing all 4 quadrants, the same as you did the auscultation portion, 9 areas to cover the 4 quadrants. And then you would also want to check the liver span, first mid-clavicular going down through, starting around the 4th or 5th intercostal space, working your way down between the rib cage, checking for that dull sound, finding the top and the bottom of the liver. And the mid-clavicular should be between 6 to 12 centimeters for normal. And then also doing a mid-sternal, which should be between 4 to 8 centimeters. After that, depending on if it's man or woman, the GU inspection or genitourinary inspection. For men, you would want to inspect their genital area for bulges, scars, especially inspecting the inguinal area for bulges that could indicate hernia. You would also check for skin and hair placement, as well as checking for infestations. With palpation for men, you would look for first inspect for scrotal and penile abnormalities, and then be checking testicularly for tenderness, lumps, masses, or lesions. With women's genitourinary, you would be inspecting for broken skin, rashes, lesions, also the distribution of skin and hair, as well as infestations, and also noting any discharge, and if so, the color, consistency, and odor of that discharge. Moving into the breast examination, you would start by a skin and color inspection, as well as looking for rashes, lesions, masses, checking the nipple and the areola of each side for size and position. Frequently, the patient needs to sit up for this. There are different arm positions they can do that help to check which side, if there is a mass that might weigh down one side or the other. Then you would move into a palpation area where you would one version that is listed as a clockwise motion from out to in, working your way around, feeling for masses, and then also starting in the axilla on each side and working your way down through the lymph node area, looking for tenderness and lymphadenopathy, making sure that there's none there. As you're working your way down through the abdomen, you would again be checking that femoral pulse area, making sure that you got that, making sure there's good pulses. And also at this point, we can go ahead and jump back in here real quick. I'm going to take one leg while I cross her grate. I'm going to check for some hip range of motion while she's laying down. So I would just relax your leg, and I'm going to bend the knee up. I'm going to push out. Good. And in. Move this one up. Out. In. Perfect. We would want to make sure that we inspect all of the joints. Actually, you can go ahead and sit up here at the bedside with your feet off on this side. Making sure that there's symmetry and no abnormality. Go ahead and hang your leg off for me. The next thing we're going to do is we're going to check your shoulder range of motion. So I would like you to start by swinging your arms out and up and then down the center. Perfect. Pull them up behind you in the back. Good. And can you cross your hands behind your back? Perfect. And then cross your hands behind your head with your elbows out. Good, there's good range of motion. There's no pain or any friction feeling in the shoulders. Perfect. We're going to check for her strength with these, so I would like you to start with your arms straight out for me. And if you can, don't let me push them down. Perfect. Don't let me pull them up. Good. Now, don't let me pull them apart. Put them out just a little bit. Don't let me push them in. Perfect. If you can, arms out and do just real quick, up, down, perfect. Range of motion is good. Make fists for me, good. And I want you to give me a quick squeeze. Go ahead, let this go again. Give me a squeeze, good. Equal grips, perfect. While we're down here, let's take a quick peek at the skin and the nails, good. We're checking cap refill, should be less than 3 seconds. Perfect. Can you put your thumbs together for me like this? We're checking for any clubbing of the nails. There's none present for that. That's excellent. Now I would like you to bend at the elbows for me. Good. And again, we're going to check strength here. Don't let me pull. Don't let me push. Perfect. We can go ahead and so the next thing that we will be doing now, moving our way on down, is checking. Go ahead and uncross for me. I would like you to try to resist against me. Raise your leg, not using your. There you go. Perfect. Raise on this side. Good. Now I'm going to stick my hand under. I want you to pull down. Good. Good. Now, making sure you stay to the side so they don't kick you in the face. We want to check the lower leg. Kick out. Good. Kick out. Good. Now pull in. Good. Pull in. Good. I'm also checking the skin while I'm down here. And then also, we're going to check for her dorsiflexion. Actually, if you swing your feet back up here so they can see you. Dorsiflexion. So I'm going to have you pull your toes towards your face. Against my hand. Good. Plantar flexion. Good. Eversion. Push out. Good. And inversion, push in. Good. While I'm here, I'm going to check her dorsalis pedis pulses. Perfect. Posterior tibialis. Perfect. Also looking for swelling in the ankles and feet. And checking her popliteal pulses as well. While we're down here. Perfect. Go ahead and stand up for me. Moving back into the remainder of our neurological tests as well as our musculoskeletal, we're going to check cerebellar function with the Romberg test. I would like your feet together. I want your arms out in front of you with your palms up. Go ahead and close your eyes for me. You want to be close, so if the patient is having neurological issues, they don't fall down. You wait for 20 seconds. You're looking for a drift in either their gait, stance, or their arms here. You can go ahead and open your eyes for me. Now, this time I want you to close your eyes with your arms out to the side. And once they're closed, right hand first, index finger to the nose, straight back out. Index finger left side to the nose, straight back out. Perfect. Okay. And then the next thing we're going to have you do, if you start over on this side for me, is we're going to check the gait. So I would like you to walk heel to toe. It's like the drunk driving test. Walk to me. Perfect. Good. On your way back, I want you to turn around. I want you to walk on your tiptoes back to the other side of the room. Good. And the way back towards me, on your heels. Perfect. If you can come right back here in the middle and turn around that direction. Good. Don't go too far. I want you to bend over at the waist as far as you can go. I'm checking her flexibility. I'm also viewing her spine, making sure there's no bulges or abnormalities in their symmetry in the shoulder blades. You can go ahead and come on back up here and turning towards the camera here. We're going to do a quick hip range of motion. So I would like you to, you already did the front, we're going to tip back, and then I want you to go side, then the other side, and then with your hands at your hips, can you turn your right arm in? Good. And your left arm in? Good. Perfect. You can go ahead and have a seat back here. This completes the head to toe examination for today, and I would like to thank you for joining me, and have a great day.